Thank you, Jan. So yes, I will do my best to keep my presentation 15 minutes because I'm talking about what's going on in this field and what's the future eventually, bringing to us. It's not that simple. I ask you if you can give me the presentation.
Thanks.
Perfect. So looking to the future, what's going on? This is the status, the actual status of what the industry can do and what the science can do in these fields. We have traditional platforms that don't think that traditional means less effective. Traditional means vaccines like polio vaccine, like tetanus vaccine. So they are great vaccines and well known, and they are based on technologies like inactivation, attenuation of viruses, or eventually taking just some proteins and combine these proteins in subunits vaccines. More elaborated vaccines are those based on virus-like particles. Just as an example, the human papillomavirus vaccine is done using these kind of platforms, so very effective, very safe vaccine. And then there are these chimeric vaccines that eventually deserve some few words in the coming minutes. And then on the right of this slide, you can see a very elaborated pentagram when you can see several new platforms that are the emerging platforms. One of those is very well known nowadays, that is the mRNA vaccine platform. It's a platform that enable to have in 1 year the COVID vaccine. And now we are very happy to hear that there are also plans to get this kind of vaccines in 100 days. So it's something that with the traditional platforms was probably impossible to get in the past. Then there are also very interesting platforms that are pretty much related with the vector-borne diseases, because these are vaccines that are based on an insect-specific virus platform. So you have an insect-specific virus that can be, for instance, the yellow fever virus. Then on this virus, you can eventually incorporate other genes and then induce the production of specific proteins. And this is something that eventually can be also give birth to some sort of this chimeric vaccine. But we will go back to that in a few minutes. Then the DNA vaccines that also we are familiar with because of the Ebola vaccines, the COVID vaccines, nanoparticles, so purified proteins that are enveloped in nanoparticles, and something that is very, very specific for the vector-borne and the mosquito-borne vaccines are vaccines that are developed not against a specific virus, but against components of the saliva of the mosquitoes. This can be eventually very innovative and sounds a bit strange, but imagine if you are able to produce vaccines that are blocking, some component that is very transversal to several mosquito-borne diseases. But this is something that is going to happen. This is the scheme of the chimeric vaccines that is worth mentioning, because now we have some vaccines in the pipeline that are exactly done using this platform that is starting, as I told you, using an insect-specific virus, an arbovirus. And then why these are chimeric? Because you have the genome of this virus, and you put into its genome the new gene that encode for the protein that you want then at the end of the process to be the component of the vaccine. So after the propagation of this modified virus into mosquito cells that are the optimal optimal medium to grow this kind of virus, then you have a purification process and you get the vaccine. Now, what is now available? I will not go in detail through the whole list of these vaccines, but just for you to know that now in Europe, we have several vaccines already available against this disease. Against dengue, against chikungunya, it was just authorized by EMA, against Japanese encephalitis, and therefore the old one, our old friends, that is the vaccine against tick-borne encephalitis, that is a disease that is since ages endemic in our continent, and the very old dear yellow fever vaccine, that is the only vaccine that is still required by WHO for international travel. So this is what we have. This is what is in the pipeline. And just for you to know that I limited the list only to those vaccines that I am aware of. So maybe there is some other study that is not included here, but these are only the phase 2-3 studies. There is a long list, a very long list of products that are in phase 1 that I didn't list because I can tell you in 50 minutes it's impossible to go through. And again, you can see that there is a new vaccine against dengue, new vaccines against chikungunya, and we have also vaccines against Zika and West Nile. Again, West Nile disease that it's already endemic in very large regions in our continent. So we have several vaccines. We have much more vaccines in the pipeline. What to do with that? This is a very, very simple and maybe naive scheme on how can we eventually use, what is the strategy to best use these vaccines that are, so good, effective, safe, etc., etc. Of course, the primary target is the travel medicine. So travel medicine services that are offering these vaccinations to the European traveler that is going abroad in an endemic area. And again, yellow fever, TB, Japanese encephalitis. Don't forget that we have since a long time these vaccines, but this is pretty much underused in Europe because the awareness of risk of Japanese encephalitis is not always there. And then dengue and the new vaccines, dengue and chikungunya. But since disease like dengue and chikungunya in Europe are presenting with pretty much large outbreaks. I saw the maps that you showed in the previous presentations. I can tell you that those maps, unfortunately, must be updated day by day because, for instance, for dengue, we recently have a very large outbreak in central regions in Italy that are not yet on those maps. And it means that we have in this season, that is autumn, in autumn, we have still local circulation in central Italy of dengue virus. So it's something, this environment is really changing very, very quickly. So is there any room for use of these vaccines in this situation when you have, a signal of establishment of a arbovirus in a new region? Is there any room for eventually thinking about vaccination for outbreak control? This is a question mark, but this is something that public health authorities should eventually answer to. And then routine immunization, why not? I mean, when this disease become endemic and start to spread, like it happened with TBE in several regions in Europe, we know that, that there is ongoing some routine immunization. TBE is a routine immunization in Austria, and it is in some regions in northern Italy, and is quite popular in the Scandinavian countries. So we have to think on how to use these vaccines. On the other hand, and I link this reflection to the previous speaker, I mean, implementing new vaccine programs in Europe is very, very hard. And it's even harder when we talk about adult immunization programs, because adult immunization is becoming an important part of the vaccination programs at national levels. We have new vaccines to be introduced. It's not just influenza. On top of flu, we have COVID, we have RSV, we have pneumococcus, we have zoster vaccination. So the adult vaccination schedule is becoming larger and larger. So is there room for new vaccines? Because I mean, when I tried to list the enemies of vaccines, one of the enemy of vaccines is fatigue. The vaccination fatigue is something real, especially after COVID. People is a bit tired of listening to public health people talking about vaccination. Okay, another vaccine. Now it was COVID, now it's dengue. And why should I get vaccinated for dengue? Is that a real problem? So these issues of hesitancy, infodemic, lack of confidence, vaccination fatigue is something that we should eventually tackle with an ad hoc communication strategy. So finally, as I told you, it's very hard to talk about such big topic in just 15 minutes, but I think that we all agree that arboviral vaccines are going to increase their role in public health. The vaccines are there, and we have a moral obligation to design an effective strategy to best use these preventive tools. But on the other hand, especially after COVID-19 pandemic, we must be very careful, and we must, let's say, put some more effort, not just business as usual. We need more effort to make these kinds of eventually new vaccination programs really effective and get people vaccinated with these new vaccines. And that's all, and I thank you for inviting me and for listening to my presentation.